So I'd been managing the pain via physiotherapy really for two and a half years. And it was when I finally got the diagnosis from an X-ray as osteoporosis, and immediately the consultant said, "Oh, you need a new hip." Initially I started off looking into the NHS. I went to the first appointment from that and I started to realise the timescales that were going to be involved. And one of the things that put me off doing it in the UK almost straight away was the lack of aftercare. And it was like 2 to 3 days aftercare, and then you're expected to go home, sort out your own physio. But what I really liked about the ESA package over here was, A, it was a lot closer. We could actually drive to France, and the hospital and the recovery were very close together. So the more I then looked into ESA and the surgeons that were involved and the hospital itself, the more I became sort of happy with the whole idea, and then managed to persuade my wife to come over for a 2-week holiday. Having spoken to Raoul on the phone, I then had a consultation with the surgeon, Dr. Monsieur. So I had two options: to have a total hip replacement or a hip resurfacing, and he's one of the very few surgeons capable of doing that. He went through the pros and cons, and because I want to keep playing sport, we opted on the method that I've gone through. So I was really pleased with the amount of time and effort he spent explaining everything.
Throughout the night you've got nurses coming in every couple of hours, which is good to know you're being checked on. Surgeon comes back in even at the weekend, which was quite impressive, just to check how you are. You start physio literally the day after the operation. I mean, it's very basic, it's sort of walking up and down the corridor, but just to get you up and moving. Second day was up and down the stairs to make sure you can do the stairs. And then the physio, once you're back in the residence, is what I would call proper physio. They're actually working with you to improve the joint movement. I think one of the other advantages of having the residence as well is you get that nurse care as well. So not only the physio, so you've got a nurse every day and she's changing the dressings every couple of days, and you've got the physio every day on site here as well, which you're just not going to get home if you go through the NHS service. When Fraser went into surgery, I just waited in his room. My suggestion really would be to maybe come back to the apartments, because it was quite a long time. It's very easy to get to and from the hospital from the apartment. You've got a bus route. The bus stop is just outside both your apartment and the hospital. I chose not to stay in the hospital in the evenings. I understand if you do, you're given a camp bed, which would be absolutely fine. However, I found it really comfortable back at the apartment. It's very modern, it's very clean. It felt very safe. There's a nice cathedral to walk around, lovely shops, coffee shops, and I'm sure you'll get to know other partners and spend time with them as well. We've been absolutely delighted with the service. ESA's been brilliant. The staff at the hospital have been fantastic. Everybody's been on time, it's been efficient, it's been clean, very clean, isn't it? The apartment's fantastic, there's loads of room in the apartment. Raoul and the team at ESA have kept in touch, they've let us know what's going on. Susan, you couldn't do without Susan. And they're great, they're just following up with you all the time just to make sure everything's okay, and nothing's been too much of a problem.